So here, guys, we will look at learning. What kind of a learner are you? All right. How do you learn? We look at this because it's important to try and kind of look within and see how you actually learn. This is important when applying for universities to make sure you match yourself well to the institution you're applying to. So we'll go through this in detail. Bear with me. Are you an introvert or are you an extrovert? Well, introverts and extroverts, when it comes to just general as a person, it means how open you like to be, how much engaging you like to be with others, as opposed to, for example, how much you might want to work on your own, do things quietly, for example, and be more of an introvert. In a similar way, some of us like to learn together. Some of us don't want to learn together. We prefer to live and learn within the confines of our own selves and do that, and then perhaps interact with people afterwards. Other people like to learn in bigger groups, right? So I think it's very important for you to kind of do a bit of self-reflection and ask yourself, am I an introverted learner or am I an extroverted learner? Am I somebody who wants to learn with other people? Am I somebody who doesn't mind learning in a group setting? Am I somebody who can actually contribute to a group discussion when it comes to learning? Set priorities and objectives, for example, and in the end, feedback when it comes to learning. So the other person would prefer going on their own, doing their own piece of work, doing their own research. They'd try to set targets themselves, address them themselves, and work to their own tune, basically. That's more of an introverted type learner. Okay? Now, I think you can see what I'm getting at here. The extroverted learner tends to be better in a group setting, tends to be better learning in a larger group. So in universities where they encourage you to work in groups, or in fact, in many universities now where they insist you work in groups, then you really need to be an extroverted type learner. In places like Oxbridge, and there's other universities that do the traditional style teaching where it's lecture based, where you have to go away and learn on your own, then perhaps as an introverted learner, you'd be more suited to that type of a teaching method. I'll cover teaching methods more in detail later on, but let's just focus on yourself right now. Have a think about exposure as well. Are you the type of person who, for example, wants to get stuck in with patients early in their career? So we have some students from universities that from day one, from year one, they're in the GP practices, they're in hospitals, they're interacting with patients, they're taking histories, they're learning live on the job. Really, it's almost like an apprenticeship style learning method. As compared to some universities, for example, students who go to St Andrews University and Oxbridge and other universities in the UK, and I'm sure similar universities exist in Australia, New Zealand, Canada, and abroad, where the initial focus is more on the learning, more on the theory, lectures, the concepts, the actual physiology, the biology, the biochemistry, pharmacology, the actual subjects, and perhaps later on in the clinical years, as it was known traditionally, in the clinical years 3s or years 4s onwards, where you start to interact with patients, where you have got more clinical experience. So if you are that type of person who wants to learn first in the books and then apply later, then perhaps a traditional method of learning is more for you. Now, that neatly kind of fits into the place of learning as well. Like some places will orchestrate learning within theatres, lecture theatres, classrooms, as opposed to in other universities where they will base learning in a kind of a clinical setting where you are led by a tutor, but you work as a group. You're in the community setting, you could be in a small room setting. So does that influence how you learn? Is that something that would affect how you learn? So really be honest with yourself and think, are you the classroom type person that you enjoyed how it was done back in school and college and you'd like to continue that type of learning? Well, think about doing a course that fits that rather than a university that implements a more group-based learning, modern way of learning, adult learning in kind of more smaller community classroom stroke workshop setting in small groups. So have a think as to where you might lie there. I've kind of touched on the group, so I'll move on swiftly to the next bit, which is, again, I've kind of alluded to that already, haven't I? In that some of us are a lot more academic than others. And by that, I mean, it's not to say that some of us are better than others. It's just the way we learn, in that some of us are more active learners, some of us are more reflective learners. So the academic learners tend to fit more into your reflective learners side, in that they want to learn the theory, the facts, the knowledge base. They want to learn all of that more initially, and then try to put that into practice and apply that within clinical settings. Compare that and contrast it with people who are more active type learners, and these are the type of people who like to learn more on the job. So there is a old adage, something that we used to hear about whilst at medical school, is you kind of learn one, right? You do one and you teach one, right? I.e., you learn it, you do it, and then you teach it. So you're doing all that actively, all right? So you're on the ward, taking histories and clerking patients in. Your tutor, your supervisor tells you how to do it better, and then what do? You go and do it again, and you do it better this time. You're in a clinical setting, and the GP that you're shadowing shows you how to do a blood pressure. Next thing you do is you do it on a patient. You learn how to do it on the next patient and the next patient and the next patient, and you get better and better. So you're actively learning on the job. And then what do? You even teach it to the next student that comes in, or somebody younger from another year perhaps. So, see one or learn one, do one, and then teach one. That's the kind of thing I'm alluding to as an active learner. As a reflective learner, what you would probably do is say, right, okay, I'm going to read about blood pressures. I'm going to look at the guidelines. I'm going to see what the technique is like, read about it, see how it's done. And then when I'm ready, I'm going to come out and practice it perhaps later, another year, or maybe the following week or whatever. That's more of a reflective type matter, a learning approach. I've mentioned about group sizes, guys, already. I won't say too much about that, in that you need to think about what type of size. So some medical schools and dental schools have smaller cohort of students, all right? So newer schools especially, they will have smaller schools compared to your large schools like Manchester have huge years of medical students and huge numbers of dental students in any given year. So do you prefer to be in that busy environment where there's lots of students and you probably will never get to know all of them, because you're literally talking 300, 400 students per year. As compare that to, for example, somewhere like Edge Hill, a new medical school where you're only going to come across literally like 20, 30 people. And it probably will grow over the years, but you're starting off with a very small number of people. And you've got some medical schools and dental schools that have less than 100 students, all right? So the smaller environment might be, something you prefer, in that you like to know everybody, you like to be part of a smaller family. So have a think about that as well. That might be something that influences your decision as to where you go and learn your trade.